I think an interesting theme that came from both the presentations was, yes, there's a role for private investments, which is really around strengthening existing public systems, that you can't really create parallel infrastructures. It's more about working within the system, strengthening it, and then, maybe looking at scaling up. So I'd love to open the floor for discussion now, first to the forum members and then to the general audience. Questions?
Thank you very much for that session. It was really interesting. I think I just want to place on record that we should really try and ensure that when we're talking about parenting, we do mean both parents. And we keep talking about mothers and what we should do for mothers. Fathers matter. Depressed fathers affect child development and child outcome. Fathers are involved in every element. And we, at our peril, will try and stride forward in early child development and leave behind 50% of the resources that children have. So just to keep remembering, we should use paternal parent rather than just focusing on mothers.
Okay. Thank you very much for the wonderful presentation. And I'm particularly interested in the South African Sherri's experience and exciting and how to build up a funding model and get the government to buy in. And obviously it's not as much a tough job to getting the trust of the Treasury. Maybe you could enlighten your experience how to build the trust so they're willing to work with you and how to build a model into the Treasury, the national budgeting. And that is not an easy part, and your experience will help us a lot. Thank you.
Thank you. Maybe just to ask for a little bit more elaboration on Ilifa around a point which I think speaks to the dilemma which was raised this morning. The dilemma that, sometimes we have NGO or outside provision, and that could actually lead to non-provision over the long term. And a thought at the time, and something we've worked on in the past, is the way in which you deliver matters. So, governments, NGOs can run projects, governments have to run programs. They can't run in the same way. An NGO can just choose to serve a particular area, can choose to serve a particular population, but governments can't do that. And so the way in which you have to provide services in order that the state can take over. Now, my understanding of Ilifa is Ilifa tries to think about that in advance. So they're trying to provide services in a fashion which will allow the state to take over. Because that's in the past proved very successful. The example of that will be left to the churches and such was raised this morning, but much of the education and healthcare system in Africa was built first by the churches and then taken over by the state, because the churches planned in the same way as the state did at a population level, whereas many of the organizations we have now are planning at a much smaller level and in a much different fashion. So maybe talk a little bit about your experience in doing that.
Along the same vein as that question, but maybe taking it a little bit further, I guess I wanted to hear a distinction between public financing and public provision. I can certainly sign up for the case for public funding, especially for poor children. But I want to hear from the panel whether you believe that there's also a strong case for public provision. What is that case? Why isn't it sufficient to have public funding for private provision?
Yes. So we'll take this round first.
Okay. This is on. Can you hear me? Can you all hear me? No. No. No, we have this one. Okay, I think this one is on. Can you hear me now? Yes. Okay, thanks. Thank you for those questions. So the partnership building aspect of the program is absolutely critical to the entire theory of change, I guess, that we are engaging with here. We are not trying to pilot an initiative. We model and we test, and we do it together with government as a critical role player in that process. And so the decision making is set up through a management team who work together on program implementation and on taking decisions with regard to the way the program unfolds on the ground. And that's at provincial government level. At the same time, the modeling and testing work happens at ward level in communities. So again, that work happens in collaboration with communities. It's around who communities are and what they need. So the drive is from the bottom up. And then it's around the institutionalization of that. So really the core of this is relationship. And at the same time, it's governed by a memorandum of understanding. And in part, we've been able to ride on the back of the huge political interest in ECD in South Africa at the moment. So it's been an open door for us in certain respects, which we've really managed to play to our advantage. And so to get provincial governments actually to enter into agreements with us, in which we articulate quite clearly what the elements of programming will be and what the various roles and responsibilities will be. We also our model is very specifically around, initially our engagement will be big, but as government gets ready to take this over, we begin to phase out. So we have a very definite exit strategy that is put in place at the same time. We're not trying to create government dependence on our team at all. It's just the opposite. So I don't know if that helps with your question. And it is difficult. And it's difficult around, I mean, we just had elections in South Africa, and with a change in government, you have a change in leadership, for example, in provincial government. And then at the moment in one province where we're implementing, we have had suspensions of the head of department 3 times in the 3 years that we've been working there. And each of these suspended heads of department are still on suspension. But and it's politically motivated. It's not really, there's not much more, but we have to work in that context, and that's the thing that we're trying to shift and engage with. And I think that's in part what's really so exciting about this work. It's really, I say sometimes it's hustling. You're working opportunistically. You're going where the door opens. You shift, you change direction, and you have to be able to work like that. So I don't know if that in part also answers your question, Chris, about the approach that Ilifa takes, but it's just, to say that I don't think that government in South Africa can provide all of the services that are needed at this point in time to all of the children who are in need, particularly given, the one province that we are working in has extremely high rates of malnutrition and stunting. There are great concerns around this. It's not to say that there isn't enough money, and I guess we saw today things around increases in GDP and so on that could significantly influence the way in which government is able to make resourcing available. The South African government does put a lot of money into early childhood development. And so this is not about trying to take over that role either. It's about recognizing that there is need for a system to change, and it's about how do we use the resourcing at our disposal to work catalytically to bring about those kinds of changes, and to enable a model that will be sustainable and will be scalable at the end of the day.
I'll only talk about the public provision question that came from you. I believe that public provision can be effective and can be efficient. The question is how to make it in the context of a particular country. I remember several years ago I went to a small village called Shivpuri in Bihar, and I found that the school was fantastic. Not only were the children learning, in fact we went there, reached there at night, and there was a whole bunch of girls sitting down and studying. And this was a school from 1st to 10th grade. And I said, but you have only grant for the 8th grade. They said, well, the rest of the money the community has put in. What essentially happened there was the government had a very loose control. Or in fact, the government had not appointed enough teachers. But there was one community leader there who decided that he's going to take charge. And he took charge and started getting contributions from people from his village who had gone and started working outside and so on, and he actually took charge and built the school. It became a community school. I think the problem with public provision happens when there is the problems of centralization. That there's somebody far away sitting and making a decision on what you're going to get and what you're going to do and how you're going to do it, with very little freedom. And that comes from a lack of trust, that if I give you a bag of money, you're not likely to use it for a good purpose, you're most likely going to use it for a bad purpose. So how do you decentralize? And there are government systems in India, in education, that work very well within the whatever the framework of whatever good education is. So it's not that it can't be done, it can be done, but you have to be able to decentralize, and that decentralization has to be done with wide open eyes and so many. So it's a matter of reform, it can be done. So I'm not, I didn't say it I suppose, but if it's, the thought is out there that public funding in private service is the only option, I don't think that is true. Because we've seen enough examples of private execution that is not good or not good enough, given whatever. So I think the key is decentralization and allowing that freedom to operate with the strength and the capabilities to run a system. I think that can be done. And that is where non-governmental, I'm not saying private as in industry, business or NGOs, and it could be just about individuals as well, who can come forward and say, I will run this. It's possible to do. In the Indian case, the midday meal scheme, interestingly there was a dilemma whether the midday meal should be provided by a local cook, hot cooked meals, and there are several companies that have come forward, foundations that have come forward, and they're providing 80,000, 100,000 meals a day with a most magnificent clean kitchen, and these meals go all over the place. And they're showing how meals can be given. Of course, they are doing some value addition as well. So I think there are a lot of opportunities to explore this kind of a partnership, but that is not.
We might find all private agencies going for health or ignoring ECD or going into education. So some kind of a regulation, guidelines and also standards to be maintained so that the disparity that you were talking of, when you have private investments coming into a public service, that can also be reduced.
My question is to Sherri. What has been the most difficult part of this project in terms of friction with the government and trying to harmonize systems and human resources? This is because we've been trying in India to do this kind of integration with the government to kind of have a more efficient fund flow system in terms of service delivery for the last 3-4 years, and we've been doing surveys, and it's somehow getting stuck in not moving that far. So I would like to know what has been your learning from your experience.
The lady, yes.
I'm Lenny Chaudhary. I'm from the Narottam Seksaria Foundation, a grant-making organization based in Maharashtra. Well, I don't have a question, just a comment on the ways of private sector's investment. Well, I can't talk about the private sector as a collective, but for individual foundations and organizations which have modest resources, strategic investment is crucial. And one of the things which we have learned in the past few years of experience is that investment in community processes through which community can engage better in better implementation and delivery of services, and finally lead to better community-based monitoring, demanding for accountability and transparency of public service delivery is an important way in which private sector can invest.
We'll take one more question.
Thank you very much. I'm Florence Paingana from Makerere University. I'm glad that Mr. Chavan brought up the issue of the community school that he mentioned, because my question was for the very poor areas, very poor geographical areas. Very often private investors don't want to go there, and at the same time they are the same areas with very low investment in the public sector. And so I don't know whether there are any other examples where, where communities have come together and worked in partnership with others, maybe the public sector, maybe other investors. I know that in Burundi, they did that for ECD, and maybe Quentin could talk to that. But they did it, and it started off as a small World Bank project, but which was then taken up by the whole country, scaled up to cover the whole country. But are there any other examples that we could learn from?
So we'll take this round first. Go first.
I was asked this question about the CSR thing. I'm not sure you can and you should direct CSR funding saying that so much percent to go to ECD, not right away anyway. I think the bigger problem in that is that, I mean, if you go and persuade a corporate sector, a business that this is where your money will make the most impact, then they should be able to come out and do it. The bigger problem is the obstacle of in my backyard, and I think it's formalized by the CSR law to some extent. People think that if you have a plant or a factory or office somewhere, then you should be developing the area around it, and that's a very myopic view of things, and I think they should be looking at, and this is where the CSR money should be encouraged to work with governments to make things better, to work better. And if that is done, then if they improve the health system, it's going to have some implications to what's happening in early childhood care, I hope. So there's a lot that can be done around there. But I think the corporate social responsibility law doesn't specifically say that. It says you design, you evaluate, and you get it done. And government did not want to be a part of it, except for saying that have you done it? And if you have not done it, declare that you have not done it and why. So I think what has happened is you've taken the first step. Let it evolve. When we talk to people who come with corporate social responsibility proposals to us, or when we talk to others, we try to make this point, and why don't you work with us and let's work together with the government to improve something. And I think the response is quite good. Once you convince them that this is possible, the response is quite good. That is the direction perhaps that we should be going into.
Okay, the question about barriers and challenges. I think the one thing that is a strength for Ilifa is that it is a donor partnership. Resourcing opens doors. And so we have been able, I guess, constructively to use the fact that we have resources and that we can bring resources to the situation. So that's the one door opener. In terms of the barriers, I mean, they're numerous. And I was just trying to think which has been the worst, but I can't think of one in particular. I mean, I think they relate particularly to, one of the things on the slide I said was Ilifa is a political activity with a small p. And I think a lot of the challenges do relate to politics. And whether they're the politics of compliance or non-compliance within a system, whether they're about an individual, and so on. And, you know, we have, I said earlier on that what's very critical to us is that this is owned by our partners and not by us. And part of the reason for that is that when there is ownership, then there is take-up in our view. Where we see this program not being taken up, it's where it's very clear that the initiative isn't owned. And so we're having constantly to work with that and to make shifts and to see how we bring people to the table. I mean, we just hit a challenge last week with the treasury work that I was talking about, where the case study comes from a particular province. And because the case study was being presented to all of the directors and treasury from all of the provinces, we later heard that that particular province felt that we had singled them out and they were immensely uncomfortable. And so, you know, so again, that potentially then is a risk, and we're having to do a little bit of problem solving around that. And what we've done is really use it opportunistically to say, okay, so let's talk again about this partnership and how we can work this out. But in part, it really is about the strength of the team and them using their skill and intuition and resource to engage on an ongoing basis as things emerge. I don't know if that helps at all.
So we're actually doing well on time, so I can take one more round of questions. Yeah, there.
Hi, I'm Shiva. I'm from Kathmandu, Nepal UNICEF office, and my question goes to Sherri. I am really very much interested to hear about the South African experience. When you said that South African government has put a lot of money now to the early childhood development. I hope I'm right, yeah? Okay, so I'm just trying to understand what is it that South African government has been so good? Is it some structural arrangement that has been made there, or is it some reform, or is it a strong political commitment? Maybe there are some 2 or 3 special, kind of experience that you may have that we can take back at home. Thank you.
Renu?
Thank you. This question is for Mr. Chavan. Thank you for raising the issue of adolescents. I think that's very critical when we're looking at ECD because they are the next generation of parents. But I'm glad that we're talking about boys rather than just girls because that's very critical. But I just wonder when you say that we should be empowering the family to look after children, what happens to the poorest quintile who are daily wage earners? What is it that we do to empower them to take good care and stimulation and provide the best potential for the child, given if we say that that's the responsibility of the family and not the government?
I'll just like to add on to what Renu said, because you were talking about mothers and educating the mothers. When we know that in our rural urban areas, the entire burden of looking after the household, looking after agriculture or going out to work, earning a living, all that comes on the woman. So are we still saying that that child also has to be looked after by the woman? Does she have the right also to work? Does she go out? And even if you don't talk about the right to work, then you know that it is more of a necessity for the woman to go out and work. So why are we putting this additional work load also only on the mother and not, on the parents or on the family?
Hero wants to say
Thanks for a great panel. I think often there's a sense that because those of us who got into early childhood development being interested in services and the kinds of programs and those kinds of things, we have more of a sense of the heterogeneity of public services and the different layers of governance than of the heterogeneity of the private sector and how best to use the private sector at different levels of a particular sector. So I think what was useful about the South Africa example was that there were efforts both at the level of service provision and then at subnational governance and planning, right? So could you perhaps both speak to the level of how you pick particular donors and which are the particular kinds of parts of the private sector that are most suited to supporting direct service provision, professional development and training, subnational planning, and then I think something that perhaps wasn't talked about as much, but the role of the private sector in national advocacy and work with policymakers, that kind of.
Okay, the question about an example of government funding for ECD in South Africa, and Chris, you might know the numbers, but there's been a significant increase in percentage-wise in the allocations of funding from government to early childhood development. For example, the per child per day subsidy has gone up each year over the past few years in a significant way. However, our challenge here is that accessing that per child per day subsidy, as I said earlier, is dependent on registration of a centre. Okay. In other words, we immediately are reducing significantly the number of children who will be able to access that per child per day subsidy. We also are immediately disadvantaging a huge percentage of children, particularly those who come from poverty-affected communities, because the centres, if they are going to centres they are attending, are the most likely centres in the country not to be registered. Okay, so in other words, that funding doesn't really, in its current way of being dispersed, talk to the poverty-affected children in South Africa. It continues to contribute to inequality. Okay, so an area of work for us, therefore, has been to say, how do we change that system to make sure that that money starts reaching the children it needs to reach and is spread in a more equitable manner. The response, for example, to continually increase the rate of the subsidy every year also doesn't recognize, again, the extent of the need. We aren't increasing the number of children who are accessing the grant. What we are doing is we are increasing the amount in the grant. Doesn't make sense. Okay, so talking to those things are central elements of the work of Ilifa. So we recognize there's a lot of government money. There's been talk here today as well about that government money is only as good as the way in which it is being spent. Is it actually contributing to a better quality of service for more children where they need it most? And the answer to us at this point is no, it isn't. And hence our work in this area. There's also a study that we did called Follow the Money. And that study really looked at where is funding for early childhood development in South Africa going, where are the blockages, and what are the systems enhancements that are needed to make it more effective. So that was at the core of some of the work that we have now been doing in the most recent couple of years. So I hope that that helps with that particular question. Your question is a big one. And in terms of which donors are most suited, which donors are have most commitment, and certainly in South Africa at the moment, I keep coming back to this, there is massive political interest in early childhood development. Our National Development Plan has included in it outcomes for early childhood development. We've just had a redrafting of early childhood policy and programming for early childhood development. So there's a big drive. And so it's a big area of interest to donors in South Africa at the moment as well. But that said, what we find in South Africa is that the donor community that is organized around early childhood development has tended to reflect or mirror the sector. So the donor community doesn't necessarily think in a forward-looking way about early childhood development at this point in time. And so we have also gotten ourselves involved there in various ways in donor forums and so on, trying to look at how can we actually organize donor thinking around early childhood development in South Africa in a strategic way. So where we might be focusing on systems enhancements and institutional pathing for early childhood development, there is still need for donors to get behind direct service provision. So how do we support donors to think through that, for example? So there are various ways which I guess this motivating and getting donors. We did a study also last year on the donor community in South Africa and who is contributing what to early childhood development and how we can be engaging more critically with that donor community. But it really is an ongoing work, and I don't know if that, I hope that answers some of what you're asking, but it does feel like a big question. Yeah, thank you.
So there are two questions which are related. You see, when I talked about families being empowered, or mothers, fathers being empowered and able to take care of the children, I was basically saying this in one particular context, that what the government or a third-party agency is saying, I will take care of your children. The attitude is that they will take care of my children or our children, and then you get weaker and weaker in terms of looking after your own children. Who has the primary relationship with the child? Who feels responsible for the future of the child? The system doesn't. The system is not caring. Now what I'm saying, I'm not saying that a working mother who has to work and do everything should also be looking after the child. Actually, she does look after her child. Or hopefully now more and more men are also going to look after their child. That's what I would like to see. So the question is not whether either or, that the mother should look after and not the caring institution or daycare. Daycare is a necessity, there's no question about it. My only question is, if the daycare is failing and if you've created an illusion that somebody else is going to take care of the child, it's not going to work, because the child will fall in between the two and nobody is going to care. This is the worry. With fragmentation of the society, with more and more nuclear families coming, there's so many structures, the social structures that are disappearing, and the natural social support that the child had, the old times, it's still quoted, it takes a village to educate a child. We've forgotten about that. We are now saying it takes only a school to educate a child. Where is this serious feeling that everybody is responsible? And so that is the whole point. Do mothers know what is good for their children, and what should be done? Do fathers know what is good for their children and what should be done? And this is the part that is missing. We are neither teaching health, we are not teaching responsibility, we are not teaching responsibility to our own parents. I am not talking bring value education. This is practical life skills education that young people must have. Practically, because they are going to face these problems, they are already facing these problems. So that's the extent of what I am saying. Daycare, institutional daycare is a necessity and it has to be done. Only thing is, what do you do when it's not there, and what do you do when it's failing? How do you create a structure? Either through a family or through a community. Is it possible? At one point, I crazily suggested in some writing that if 100 hours of work can give Manrega, the National Rural Employment Guarantee Act can give 100 days of work, manual labor, then why can't a new mother or a new father get daily wage for looking after children for the first 2 or 3 years? It's a very simple thing. And if you don't provide the care, I know some people are going to shake their head and say, here we go again. But actually, if it's a need, maybe if you have enough money, you could do that. It need not be done exactly in cash terms. It could be done in some other ways. I don't know. But there has to be a recognition that that child deserves to be cared for. And if you can't provide that care, then come up with a solution. And that's, I think, what the conference is all about.
Thank you. Very interesting panel discussion. Hopefully we'll continue the conversation over coffee as well. Thank you.